Listen, I need to talk to you about something that's been keeping cardiologists up at night. And if you're over 65 or you have a parent or grandparent in that age group, you need to hear this because what I'm about to share with you could literally save a life. Did you know that right now, millions of older adults are taking medications that are supposed to help them, but instead, these pills might actually be causing serious damage to their hearts? I'm not talking about some obscure drugs that nobody's ever heard of. I'm talking about medications that are sitting in medicine cabinets across America right this very moment. The silent epidemic nobody's talking about. Here's something that's going to shock you. The average older adult with heart failure takes nearly 7 prescription medications every single day. 7. And when you're talking about people over 65 who've been hospitalized for heart problems, researchers found that those taking 10 or more medications may be especially vulnerable to negative interactions. But here's where it gets really concerning. Among those 7 medications, there's a very real chance that at least one of them is actually making their heart condition worse. Not better, worse. Think about that for a second. You go to the doctor, you get prescribed medication, you trust that it's going to help you, and instead, it might be quietly sabotaging your heart health. This isn't some conspiracy theory. This is documented medical science, and it's a problem that's been growing year after year. The number one culprit, your pain reliever. Let's start with the biggest offender, and this one's going to surprise a lot of people because it's something that millions of Americans take without a second thought. I'm talking about NSAIDs, non-steroidal anti-inflammatory drugs. You know them by their brand names like Advil, Motrin, Aleve. And yes, this includes prescription strength versions like diclofenac and indomethacin. Now, before you think, well, I only take these occasionally for a headache, listen to this. More than 70 million prescriptions are written every year for this type of pain reliever, and that's just prescriptions. That doesn't even count the over-the-counter bottles that people buy without any prescription at all. Here's what these medications do to your heart. They cause your body to retain water and salt. They make it harder for your blood to flow properly. And they actually interfere with other medications you might be taking for high blood pressure. It's like they're working against everything your heart needs to stay healthy. And the data on this is absolutely clear. In a large observational study of over 107,000 older adults with heart failure, researchers found a significant dose-related increased risk of hospitalization, heart attack, and all-cause mortality for those taking these medications. But here's what really gets me. These aren't just prescription NSAIDs. We're talking about the stuff you can buy at any drugstore, any grocery store, any gas station. People pop these pills like candy for every little ache and pain, never realizing they're playing Russian roulette with their heart. The diabetes medication dilemma. Now let's talk about diabetes medications because this is where things get really tricky. If you're an older adult with both diabetes and heart problems, you're caught in what I call a pharmaceutical crossfire. There's a whole class of diabetes drugs called thiazolidinediones. The brand names are Actos and Avandia. And here's what the research shows about these medications. They cause fluid retention, they cause weight gain, and in people who already have heart failure, they make the condition significantly worse. But wait, there's more. Even some of the newer diabetes medications have raised red flags. There's a group of drugs called DPP-4 inhibitors, and these medications seem to send people with heart failure to the hospital, though doctors aren't entirely sure why yet. And let's not forget about metformin, which is probably the most commonly prescribed diabetes medication on the planet. Now, metformin itself isn't necessarily the problem, but here's the catch. Your body gets rid of metformin through your kidneys. So if you're an older adult and your kidneys aren't functioning at full capacity anymore, which is actually pretty common as we age, then metformin can build up in your system and cause serious problems. The blood pressure betrayal. This is where things get really ironic. You take blood pressure medication to protect your heart, right? That's the whole point. But certain types of blood pressure medications can actually backfire on older adults with heart conditions. Calcium channel blockers are a big one here. These medications can worsen fluid buildup in your body's tissues. Imagine your feet and ankles swelling up, your legs getting heavy, fluid accumulating in places it shouldn't be. That's not helping your heart, that's stressing it. Then there are medications called alpha blockers. You might be taking these for high blood pressure or for prostate problems. But here's what happened when researchers looked at the data. In a major trial, the risk of heart failure was doubled in patients receiving doxazocin, one of these alpha blocker medications. Doubled! That means if you had a 10% chance of developing heart failure, this medication potentially bumped it up to 20%. Those are not good odds. The cold medicine trap. Here's something that catches people off guard all the time. You wake up with a stuffy nose, you're feeling congested, so you head to the pharmacy and grab whatever cold medicine is on sale. You don't even think twice about it because it's just cold medicine, right? Wrong. Many cold and sinus medications contain NSAIDs, which we've already talked about, but they also contain something else that's problematic for your heart. They contain decongestants, and these decongestants work by narrowing your blood vessels. On the label, you'll see the word vasoconstrictor. Now, narrowing your blood vessels might clear up your stuffy nose, but it's also making your heart work harder to pump blood through those narrowed passages. If you already have heart problems, this is the last thing you need. And here's the kicker. Most people don't even read the labels on these over-the-counter medications. They just assume that if it's sold without a prescription, it must be safe for everyone. But that assumption could be putting your heart in serious danger. The vitamin E myth. Now, I want to talk about something that a lot of people think is actually good for their heart. Vitamins and supplements. We've been told for years that vitamins are healthy, that they're natural, that they can't hurt us. And while that might be true for the vitamins you get from eating actual food, when you're talking about high-dose vitamin supplements in pill form, it's a completely different story. Take vitamin E, for example. You can walk into any health food store and find bottles of vitamin E supplements being marketed as good for your heart. But here's what the research actually shows. More than 400 international units of vitamin E daily can increase your chances of developing heart failure. Let me repeat that. The vitamin that's supposed to be protecting your heart might actually be increasing your risk of heart failure. How's that for ironic? And vitamin E is just one example. There are countless other supplements out there making health claims that haven't been properly tested in older adults with heart conditions. Remember, dietary supplements aren't regulated by the FDA the same way that prescription medications are. You can't always be sure that what's on the label is what's actually in the bottle. The beta blocker bombshell. Now here's where things get really interesting, and this is breaking news that's literally changing medical guidelines as we speak. For over 40 years, beta blockers have been the standard treatment after a heart attack. Doctors have been prescribing them automatically, without question. But a massive international study called the Reboot trial just turned everything we thought we knew upside down. Beta blockers provide no clinical benefit for patients who have had an uncomplicated heart attack with preserved heart function. No benefit. After 40 years of prescribing these medications to millions of people. But it gets even more concerning. The study found that women treated with beta blockers actually had a higher risk of death, heart attack, or hospitalization for heart failure compared to women who didn't receive the drug. Men didn't have this increased risk, but women did. Now, I want to be very clear here. This doesn't mean you should stop taking beta blockers if your doctor has prescribed them. What it means is that medical science is constantly evolving, and what was considered standard treatment yesterday might not be appropriate for everyone today. The polypharmacy problem. Here's the thing that really ties all of this together. It's not just about individual medications being problematic. It's about the sheer number of medications that older adults are taking. Polypharmacy, which is defined as taking 5 or more medications regularly, has become incredibly common. Between 2000 and 2012, polypharmacy prevalence among older adults increased from 24% to 39%. That's a massive jump in just 12 years. And when you're taking multiple medications, you're not just dealing with the side effects of each individual drug. You're dealing with the interactions between those drugs. Drug A might be perfectly safe on its own. Drug B might be fine on its own. But when you take them together, that's when unexpected problems can emerge. Think about it like this. Your body is like a complex chemical factory. Every medication you take is throwing new chemicals into that factory. 1 or 2 new chemicals, and the factory can probably adapt. But 7, 8, 10 different chemicals all at once, that factory starts to struggle. Things start to go wrong. The hidden danger of drug interactions. Let me give you a real-world example of how this plays out. Let's say you're taking a diuretic for high blood pressure. That's a water pill that helps reduce fluid buildup. Pretty standard medication, right? But then you take an NSAID for your arthritis pain. And what does that NSAID do? It causes your body to retain water and salt, and it interferes with how well your diuretic works. So now your blood pressure medication isn't working as well as it should be. Your body is retaining more fluid, and your heart is under more stress. But you don't see any of this happening. There's no warning light that goes off. You just feel a little more tired, maybe a little more short of breath. You might think you're just getting older. You might not connect it to the medications at all. And here's the really scary part. When older adults take multiple medications with known cardiovascular risks, there's a twofold increase in the risk of major adverse cardiovascular events. We're talking heart attacks, strokes, sudden cardiac death. The prescribing cascade. There's another phenomenon that happens with older adults that medical professionals call the prescribing cascade, and it's exactly as problematic as it sounds. Here's how it works. You go to the doctor because you're experiencing a symptom. Let's say you're feeling dizzy. So your doctor prescribes a medication to treat the dizziness, but that medication causes another symptom, maybe nausea. So you go back to the doctor and you get prescribed another medication to treat the nausea, but that medication causes yet another side effect, and on it goes. Before you know it, you're taking 5 or 6 different medications, and you've lost track of which medication is treating which problem, or whether some of those problems were caused by the medications in the first place. This isn't a criticism of doctors, by the way. Doctors are working within a system that's incredibly complex. They're seeing patients for 15-minute appointments. They're dealing with insurance requirements and treatment guidelines. They're often specialists who only see one piece of the puzzle. Your cardiologist might prescribe one set of medications. Your endocrinologist prescribes another set. Your primary care doctor adds a few more to the mix. And unless someone sits down and looks at your complete medication list, really looks at it, these interactions can slip through the cracks. What you need to do right now. So what's the solution? What are you supposed to do with all this information? First, and this is absolutely critical, do not stop taking any prescribed medication without talking to your doctor first. I cannot stress this enough. Suddenly stopping certain heart medications can actually be more dangerous than continuing to take them. But here's what you can do. You can become an active participant in your healthcare. You can start asking questions. When your doctor prescribes a new medication, ask these questions. What is this medication for? What are the potential side effects? How does it interact with the other medications I'm taking? Is there a safer alternative? Do I really need this? Or are we just treating a symptom that might be caused by another medication? Second, make a complete list of every medication you're taking, including over-the-counter drugs and supplements. I mean everything. That multivitamin? Write it down. That baby aspirin? Write it down. That ibuprofen you take occasionally? Write it down. Then bring that list to your doctor and ask them to review it. Ask if all of these medications are still necessary. Ask if any of them might be problematic for your heart. Third, be extremely cautious about over-the-counter medications. Just because you can buy something without a prescription doesn't mean it's safe for you specifically. If you have heart problems, if you're over 65, talk to your pharmacist before buying any new over-the-counter medication. Pharmacists are incredibly knowledgeable about drug interactions, and they're usually more accessible than doctors. The bigger picture. Here's what really bothers me about this whole situation. We have more medications available than ever before. We have more treatment options than at any point in human history. And yet, older adults are ending up in the hospital because of the very medications that are supposed to be keeping them healthy. The medical community is starting to wake up to this problem. There are new initiatives focused on something called deprescribing, which is exactly what it sounds like. It's the process of carefully reducing or eliminating medications that might be causing more harm than good. But change in medicine happens slowly. It can take years, sometimes decades, for new research to make its way into everyday medical practice. The reboot trial that I mentioned earlier, the one that questioned 40 years of beta blocker use, that just came out recently, and it's going to take time before those findings change how doctors practice. In the meantime, you have to be your own advocate. You have to ask questions. You have to push back when something doesn't feel right. The hope on the horizon. I don't want to leave you feeling hopeless, because there is hope. Medical science is making progress. We're getting better at understanding how different medications interact. We're developing better tools for identifying which patients will benefit from which drugs. There's increasing awareness about the special considerations that older adults require. Age isn't just a number, it's a biological reality that affects how your body processes medications. Your kidneys work differently at 75 than they did at 45. Your liver metabolizes drugs differently. Your body composition has changed. All of these factors affect how medications work in your system. And more, there's a push toward personalized medicine. Instead of following one-size-fits-all treatment guidelines, doctors are starting to consider individual patient factors. Your overall health status, your quality of life goals, your personal risk factors, these are all becoming part of the conversation. Your heart deserves better. Here's my final message to you. Your heart has been beating every single day of your life without you even thinking about it. It's pumped millions of gallons of blood through your body. It's kept you alive through everything you've experienced. Your heart deserves better than to be damaged by medications that are supposed to be helping it. If you're an older adult, or if you care about an older adult, please take this information seriously. Have that conversation with your doctor. Review those medications. Ask those questions, because the life you save might be your own, or it might be someone you love. And remember, this isn't about being against medication. Medications have saved countless lives. They've improved quality of life for millions of people. But like any tool, they need to be used wisely, carefully, and with full awareness of their potential risks. Your health is too important to leave to chance. Take control, ask questions, be informed. Your heart will thank you for it.